wellness revolution starts now.
Welcome to our show. Today we're going to be interviewing a guest here at Hotze Health Wellness Center, Ryanne Siddiqi. We're going to be talking about a modality that we have here. It's called IASIS microcurrent neurofeedback, and its use in our ADHD and brain support program. So just to get to know you a little bit better, Ryanne, how long have you been a guest here?
I have been a guest at Hotze for a long time. I think 13 years.
Oh, wow. That's a long time. Can you be, if you don't mind, can you give us some information about what brought you to the Health and Wellness Center?
So originally I came because I saw an advertisement in a magazine saying something about, your symptoms don't lie, but your test results do, or something along those lines. And I was just, I'd been struggling with fatigue and, told, oh, it's depression. And I'm like, no, that's not it. So, I saw this magazine advertisement and I said, I want to go to a doctor that believes, that it's more than just, take a pill and here you go. And so that started my journey, and helping get my hormones balanced. And it wasn't all in my head, which was pretty awesome to have somebody that actually believes you. When you say I have all these symptoms and they say, oh, no, you don't. So I was very thankful to Dr. Ellsworth that he believed me and helped me. So that's how I started my journey here.
Okay. So what has your experience been then?
My experience has been I'm so grateful to everybody here. I come for, the beauty treatments. I come for, health checks. And I'm just so incredibly grateful to the whole program. It's been a journey. It's been a journey. And, everybody here has been with me every step of the way, just really wanting to make sure that I'm feeling as good as I can be and not just another number in the system, and wanting to just be able to bill insurance and get me on out of here and all of this. So, it's been a struggle. We've found a few things that we had no idea we were even looking for. And I'm grateful to somebody that, they've stuck with me and, helped me in my journey. So here we are.
Well, that's excellent. I'm so glad we were able to help you. And Dr. Ellsworth is a great guy. So we're actually here, though, today to talk predominantly about your son and his experience here with the modality that we use called IASIS microcurrent neurofeedback. So can you tell me a little bit about your son, what prompted you to seek help here?
So the story with my son is that when I was pregnant with him, I could have told you that he had ADHD. He was just incredibly active, and he has not stopped a single moment his entire life. He's amazing. He incredibly intelligent. Just a sweet, sweet soul. But we were managing all of the ADHD stuff as far as we thought pretty well, until there was kind of a traumatic event that happened. A family member who was living with us ended up having a heart attack in our living room while all of us were home. And, my husband is performing CPR and I'm on the phone with 911. And the kids were just kind of there watching.
And how old is he at this time?
So he was 6 at the time. Okay. And what happened is this was right at the beginning of school year. So he was just starting first grade, and he struggled. He struggled at the beginning of the school year. He was highly reactive, just very aggressive. And school was really wonderful. They worked with us. They understood what was going on. And eventually it kind of all calmed down. So we make it through almost the whole rest of the school year until about March. And the family member ended up passing away.
Oh, so he actually survived the cardiac arrest event.
He had survived, and was hospitalized, and so a lot of back and forth every day to the hospital, and just all of life's craziness going on. So when he passed in March, the reactivity kicked up again, even worse. And, the focus, really it was the reactivity. It was like every little thing would just trigger him and set him off. And the screaming and, the physical violence against others. And, at this point, he had been seeing the school therapist. But school said, you know what, you need to get him evaluated. At that point, it was so bad that while we were waiting for the results, she's a friend of mine, but she also works here at Hotze. And she said, well, when my son had this traumatic event, we did this really cool brain thing. And, it really helped her son. So I said, you know what, because we're in this waiting pattern and this is bad, we needed something. I said, let me try it. Let me try it, because at that point we were kind of desperate. So that's how we came.
Okay. Well, it's not unusual for people who have a brain predisposed to manifesting ADHD during a traumatic event or subsequent to a traumatic event to experience an exacerbation of their symptoms. Part of the problem with ADHD is there's an issue with the executive functioning portion of the brain, prefrontal cortex. And when you have a traumatic event, sort of the limbic system, the emotional brain takes over and can redirect blood flow and control from the prefrontal cortex. So it makes sense that he would experience a significant increase in his ADHD. So you had a lot going on there. Does he have siblings or?
I have a daughter as well.
Okay. And how was he towards at home and with your daughter? I know school was challenging, but
life was challenging. Even with us at home, he was highly reactive towards his sister. He was highly reactive towards me. There were lots of tears on his part, on my part, on my daughter's part. My husband, not so much, because he, was kind of holding everybody together and in all of these different places at one time. Whereas, I was the one who was home, while all of that other stuff was going on, and I had the kids most of the time. So, it was not pleasant at all.
So I know that he was seeing a counselor at school. Had you tried anything else, any other interventions, and as a prelude to the neurofeedback?
At that point, no, because like I said, we were waiting for those results, and we needed something. We needed something right then, because it was getting that bad. So when my friend mentioned this, that's when we just kind of jumped on it.
Okay. And what was your first experience with the neurofeedback, the session, and your understanding of what was going to happen?
So I really loved the way that the girls explained everything to us. And, they really took the time to talk to my son directly and, hey, we're going to do this. And, this is what it's going to feel like. And so I was very grateful to them for that. And And I mean, as far as I know, like, I wasn't signing him up for anything that was going to hurt him. It was just maybe a sensation. So that was my understanding. And then we did begin to call it, because he had his therapy appointments and then he had these appointments. We called it his brain tickle appointments. Oh, so that's how we refer to them.
Cute way of describing it. So, and then I guess he didn't experience any other adverse events as opposed to a brain tickle then.
Right.
Okay. And so how soon after his first session did you notice any impact of the therapy for him?
So I came in kind of understanding from my friend and her experience, that it took a few sessions before she noticed any differences, but she was kind of, in awe that it was only a few sessions. And so that's kind of, where I came in with, if we don't see anything after a few sessions, I'm not going to expect anything immediately, but, after a few sessions, I'm hoping I'm going to see something. And we did. It was, again, not the first time, not the second time, but, there were small changes, even those first two times. And then, we really started to see differences third, fourth, fifth, and on, which was amazing. And it was what we needed.
And what was sort of the progression of resolution of symptoms that he was experiencing?
It was just, there was less reactivity. Yeah. There was, less aggression. There was less screaming, so it was just, he was sleeping better and, able to handle things better as they came up.
More resilient.
Exactly. Exactly.
Okay. Excellent. So it might be helpful to explain a little bit about what IASIS microcurrent neurofeedback is. You've done a great job, and I love that the term brain tickle, and we would have to utilize that in some of our advertising. But, people with ADHD experience multiple challenges, and one of the main challenges is a neurologic challenge. There's reductions in blood flow to certain parts of the brain, like the prefrontal cortex. Those, because of the reduction in blood flow, there's actually smaller. Those structures are smaller, and there are some abnormalities in the brainwave patterns in people, demonstrable brainwave abnormalities in people that have ADHD. And so IASIS microcurrent neurofeedback is more broadly defined as sort of a passive neurofeedback because it doesn't require anything other than the presence of the person to experience that. It's probably more specifically defined as EEG directed. So we put some electrodes on the scalp that measures the brainwave patterns, and it's directed via that, and we give transcranial electrical stimulation. So the device detects abnormal brainwave patterns and sends an imperceptible to most people offset signal to the brain, moving the brain off of those abnormal brainwave patterns. And in doing so, it stimulates neuroplasticity, which is the production of new neurons in the portions of the brain that those can still be made, which is in the limbic system, which is where people experience traumatic events like the cardiac arrest of your loved one and then the hospitalization and the death. And that's so traumatic and involves so much the entire family. And it's really on an impressionable young person, it's understandable why that it might cause an exacerbation of his symptoms. But it also, and as such, the device actually stimulates the body to go into that rest, digest, and repair state. The parasympathetic branch of the autonomic nervous system is stimulated, and so that can take the pressure off that limbic system and allow more blood flow to go to the prefrontal cortex, where that executive function, where he can make good decisions. He's not so impulsive, not so reactive. And then we also know that when people sleep better, which is one of the primary ways that IASIS helps, the brain shrinks a little bit during sleep. And there's a portion of the lymphatic system called the glymphatic system that helps the brain to detoxify. So we live in a toxic world and it's sort of a toxic soup. And anything that we can do to allow the brain to detoxify is going to, just amplify cognitive performance. And so, that is, in a nutshell, the way that it works. And it's just been evidenced in the way that your son has sort of responded to those therapies. And so, what would you characterize as the biggest difference that you've seen in him since starting the therapy?
I mean, the anger is not there anymore.
Okay.
The anger, the reactivity. I mean, he's back to, happy, normal self, and not this kid who just has a trigger for everything. So, I mean, it's hard to see your kid struggle. So I'm just incredibly grateful that we were able to find this, because with therapy, he would actively avoid. They would kind of sidestep the question. They would ask it directly. And he's like, no, I don't want to talk about that. Just very matter of fact. And it's like, okay, well, what else can we do? So we're very, very grateful to have access to this, to be able to have him do this, because it did make a huge difference.
Excellent. So one of the main issues that people struggle with ADHD, especially as a school-age child, would be school performance. So did he initially have issues with school performance, and then has there been improvement in his school performance? I understand that relationally things are better and his emotionality is much better, but when the rubber meets the road, people want to know about school performance. So has that been impacted?
Hugely.
Okay.
Over the following year, so while he was going through the program, his improvement scores have been 98, 99
Excellent.
percentile. So yeah, I mean, if you're looking for a measurement, we got one.
Excellent.
And you can look at exactly when the traumatic event happened, his scores dropped, and then, they went back up mid-year, and then they dropped again at the end of the year. And then the following year, just to see them, like, the huge improvements. And like I said, 98, 99th percentile for improvement in, I think, all three categories. So
Wow, that's incredible.
Yeah.
It's incredible. Well,
we were so grateful.
Well, thank you so much for giving us your insight. And I'm sure this is going to be very encouraging for families struggling with similar circumstances as you, ADHD. And we know that IASIS is a powerful tool in addressing other mental health challenges like depression and anxiety. And because of the powerful mind-body connection, there's a lot of physical ailments that can be impacted positively by IASIS microcurrent neurofeedback. We do know that it's typically best administered on a sort of foundation of natural health and wellness. And so we do offer an ADHD brain support program here that looks at the entirety of the person, sort of like they took care of you, not just saying, okay, ADHD is a described physical or mental challenge, however you want to label it, and as such, we can give you a pill. But we know that there's genetic predispositions to ADHD, there's environmental factors that are involved, there's nutritional factors that are involved. And so the brain support program here helps to address all of those factors. And then it's also just a great adjunct to those things like depression, anxiety, perimenopausal, menopausal symptoms, so many different things just like I said, because of the powerful mind-body connection. So again, I appreciate you, Ryanne, for being on our show, and we just hope that this is an encouragement to the folks out there. And if you would be interested in finding out more about IASIS microcurrent neurofeedback here at Hotze Health Wellness Center, or one of the many other health conditions that we can help to ameliorate for you by putting you on a path to health and wellness naturally, we'd love to speak to you.
Did you know that pharmacists are considered the most accessible healthcare professionals, and yet at the same time we are generally the most underutilized? Pharmacists are medication experts, which means that we can best advise you on the safe and appropriate use of your medications, when to take them and how to take them. We're experts in pharmacology, which means that we receive extensive training to understand the science behind how medications work within the body. We screen for any interactions which may occur between the medications you're taking, and we have an in-depth understanding of how these medications affect each system of the body. Your body is unique, which means that the type and dose of medication you take should also be unique. We want you to know that at Physician's Preference Pharmacy, we are always available to you, and we welcome your questions.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.